Spotlighting Hawaii's leaders.
We want to bring in Governor David Ige.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei-Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Aloha and good morning. Thanks so much for tuning in here on this Monday morning. I'm Ryan Kalei-Suji, joined by Yanji Denise, and this is Spotlight Hawaii on the platforms of the Honolulu Star-Advertiser. And Yanji, this morning we head back to the Hawaii State Capitol.
That's right. Joining us live from his office at the Capitol is Governor David Ige. Good morning, Governor.
Good morning. Thanks, Yanji. Thanks, Ryan. Thank you really for giving me this opportunity to talk and dialogue with the public.
Well, we appreciate you being here, and there's some good news this morning, relatively speaking. I believe it's 97 cases today. This is the first time we've seen double digits for a while. When we had Dr. Libby Char on last week, she said that when we were at a daily average of double digits, that was a level that she would feel comfortable with. You know, I mean, we don't want any COVID in our community, but that was a level that she was more comfortable with. How are you feeling about things right now?
Yeah, certainly the trend is in the right direction, and we continue to relax restrictions, and we want to be careful and thoughtful about that, because what we would like to get is where the new case counts are below 100. That's something that we're certain that our healthcare system could respond to. We can do the contact tracing and identify those who are sick, and then really provide them healthcare, which is what we all want.
One of the things that happened this past weekend, of course, the University of Hawaii football team was able to play in front of some limited fans at their field. We also saw the reopening of other venues that allowed vaccinated people to come into their facilities. What are your thoughts with this overall rollout, and when do you think any more changes will be made to accommodate potentially even more people into some of these venues?
Ryan, we'll be looking at it every 2 to 3 weeks, and slowly increasing the numbers that will be able to go to events and activities. What we want to make certain is that we don't start to surge again. And what we're concerned about is that if we reopen too quickly, that the case count exceeds 100, and we'll never be able to get it down below 100.
Speaking of large events, one of the marquee events for December in Hawaii, of course, is the marathon. What are your thoughts on that going forward? Do you expect the marathon to be able to take place?
Yeah, certainly. We've been meeting with the mayors, and I know that I spoke with Mayor Blangiardi specifically about the marathon. We're hopeful that the case counts will drop, and he's given the green light to the marathon being held. And we're hopeful that the trend continues so that we can expand the participation in the marathon. As you know, it is one of the premier athletic events. It's outdoors. We do believe that we can hold it in a safe way. It won't be the same marathon as it usually happens, because we won't get the number of visitors from Japan that we normally get. But we are hopeful that we can expand participation and increase it as the case counts remain low.
Speaking of visitors from Japan, we know beginning November 8th, the U.S. will welcome back in visitors and citizens traveling from international destinations. And earlier today, the White House actually said that it will require U.S.-bound travelers to provide proof of COVID vaccination, contact information for contact tracing, and also show a proof of a negative COVID test that was taken 3 days before departure. But another change that they announced today was that the inbound travelers, including citizens as well as visitors who are unvaccinated, will have to show a proof of a negative test taken 1 day before travel. How will these new policies, you think, impact the overall safe travels program here that we have set up in the state of Hawaii?
Ryan, we're working to ensure that we can align with the new travel requirements, especially for international travel. It's a huge difference for international travel, because the airlines will take responsibility for ensuring that the travelers meet all of the requirements of the United States in order to enter. We have been talking with our travel partners, the airlines, from Japan, Canada, Australia, who are all interested in restarting international travel. And we're working to ensure that they are completing the vaccination verification. We also are working, Ryan, to get samples of what an Australian vaccination record looks like, what the Japanese and the South Koreans and Canadians, just so that we can distribute that to our businesses as well. I mean, I know that many will still be requiring vaccination, and we want to make sure that as many in our community can recognize what a Japanese, Australian, South Korean vaccination record looks like, so that they can allow those who are vaccinated into their facilities.
Beyond the international travelers, just sort of broadly speaking, how long do you think Safe Travels, that program, will stay in place? Is there a national vaccination threshold that you're looking at to say, okay, when this much of the U.S. mainland has been vaccinated, then we can lift this program? Or is that something that you just expect to be part of the Hawaii travel experience for some time to come?
Yanji, we do anticipate that Safe Travels for domestic will continue as long as there are those traveling who are not vaccinated. We do want to protect our public, and about a third of the travelers are not vaccinated or not tested right now. I guess maybe it's not a third, about 20% of those traveling don't get tested and don't prove their vaccination status. So we want to make sure that those travelers are subject to quarantine and isolation, because if they're not vaccinated and they don't test, we want to be able to isolate them.
There are some who are calling for the state to maybe amend the Safe Travels program to be more in line with what the international rules may be. So would you, I guess, at this point, consider changing things within the Safe Travels program to also require, a 3-day test for those that are vaccinated and maybe a 1-day test for those that are unvaccinated prior to travel, to keep everything in line with what maybe the federal guidelines are?
Certainly, Ryan, remember, for those who are unvaccinated traveling domestically, they are subject to quarantine when they arrive here. They can take a pre-travel test, a PCR test, and be exempted from quarantine 72 hours before. We are constantly looking at the changing CDC guidelines. I know that the CDC has begun to recognize antigen tests. So we're looking at which ones of those tests we believe are accurate and reliable that we would want to incorporate into Safe Travels program. We are trying to be as aligned with the CDC requirements. Even though there are a number of states that have ordered quarantine for those who are not tested or not vaccinated, Hawaii is the only one who's actually doing something about it and being able to identify those who are not vaccinated or pre-tested and really trying to ensure that they are in quarantine.
So if Safe Travels is here to stay for the foreseeable future, and we know that immunity does wane, which is why boosters are being recommended for our elderly population, and eventually the expectation is that the entire population will likely have access to, and perhaps even be required to have, a booster for vaccine verification. Do you anticipate having to have boosters as part of the Safe Travel program, so that the immunization is up to date, if you will?
We are working to incorporate the boosters into the Safe Travels program, at least recording the information. Yanji, the data continues to show that vaccinations are very effective at preventing serious illness and reducing the possibility of death. And so I think that that's the good news in a lot of the data that was presented. We do want to, and I do believe that our community, those who are already vaccinated, are anxious to get the booster. I think that all of us understand that it's not only about keeping ourselves safe. It really does. The booster will help us keep our family members safe, especially those who are younger, our young children who are not able to get vaccinated at this time. And it really does help us keep our friends and neighbors protected, because if I don't get COVID, then I won't be able to give it to someone else.
Are you at all concerned about the number of visitors that could potentially be coming to our shores here? We know that you made a statement last week saying that beginning November 1st, you welcoming in all those who are vaccinated and that Hawaii will be open for business once again. So when you factor that announcement in with travel from the U.S. mainland, as well as these international travelers, are you concerned at all that we could see a large uptick and the overall capacity of what we are able to handle right now? And some of the concerns that were brought up during the last surge over the summer that we saw between visitors and locals.
Ryan, we are fully into implementing the destination management action plans that HTA has been working with the industry as well as the community to identify really those hotspots and friction points. And we are really beginning to fund the solutions that have been identified. We're hopeful that the legislature will fund HTA so we can continue those actions, because it's really important. It's not a one-shot activity. We do know that we have to be focused on these friction points and really find solutions and implement them to reduce the impact of visitors on our communities. We expect a slow ramp up, especially from international travel. I've been speaking with the airlines. They don't anticipate a huge rush. They'll be increasing the number of flights as they can fill them. But there still is a global hesitancy about travel. COVID is still something that people are concerned about. If they're vaccinated, I think they would be in a better position to travel. But we don't. We expect a strong winter season for our visitor industry that would allow them time to increase the hiring. As you know, it's been difficult to hire the employees that they need. But what we're trying to do is be thoughtful in how we relax the restrictions so that our restaurants can, get back to hiring employees, our hotels, and we can slowly expand capacity. So as visitors return, they have things to do and places to go.
One of the places we know they like to go are restaurants. Heidi has a question. Can you please ask if Governor Ige and Mayor Blangiardi will keep safe access, she means safe access Oahu, in place, and if it will expand to all the islands? We know that safe access Oahu obviously is the purview of Mayor Blangiardi, but there was talk at one point of perhaps having vaccine verification for certain venues statewide. Is that something that you're looking at all?
We certainly are, Yunji, and talking about it. And we have been talking with the Hawaii Restaurant Association. What I've heard loud and clear is what they need is some planning horizon. They can't instantly open up or they can't instantly shut down, or it really creates fiscal impacts for them. So we'll be working with them about how to, in a safe way, expand capacity in the restaurants and get back to that new normal. As you are aware, Dr. Char talked about a baseline caseload of less than 100 is what she would be comfortable with. I think if we can do that and get our restaurants back to a full capacity in a safe way and not see that surge, I think that's what we're building to. And we do know that relaxing the restrictions in a measured way will help us get there.
One of the big pushes has been for, of course, vaccinations, and we did see that uptick during the surge of the Delta. Right now, the focus seems to be on boosters and getting those shots out available, as well as the vaccine available for children. If you can give us an update as to this point in time, are you happy with where we're at with the state, the vaccination rate, and what efforts is the state doing to help to prepare for getting these vaccines available for children?
Thanks, Ryan, for that question. The state has responded very well. I think the vaccination rollout in Hawaii has gone better than virtually every other state in the country, and really wanted to thank our private sector partners, the hospitals, HPH, Queens, they all have really stepped up to the challenge. They've made their facilities and their employees available to help us get people vaccinated. So I think we're in a real good position. The boosters, as you know, there was a lot of boosters approved at the end of last week, boosters for Moderna and Johnson & Johnson. And the whole notion that if you have and you are vaccinated for any of the vaccines approved, that you can get a booster from any of the others, I think will make it a lot easier to administer vaccinations. We are getting prepared for vaccinations for children. And I know I've spoken with many parents, moms and dads who are just anxious. Their children are not vaccinated and they want to get their children vaccinated. So we are really preparing. We've already placed orders for the children's vaccines. Our allocation is about 40,000 doses, which is about a third of those children ages 5 to 11. We'll have more than 150 locations where people can get their children vaccinated. We are planning vaccinations in schools, and there's more than 100 schools that have already indicated that they would want to make vaccines available on their campuses. So we believe that this is a game changer. It really gives parents the opportunity to protect their children. And we want to be prepared, and we'll be rolling out the vaccines as quickly as we can receive them.
I want to dive a little deeper into those numbers. You said 40,000. Is that something that will come in waves, or is that an initial shipment? Will we expect all that 40,000 to be available at the same time? Tell us a little bit about that rollout when it comes to the numbers. And I would assume that once we exhaust the 40,000, hopefully we get more.
Right. So Yunji, the White House has really been focused on distribution of the vaccine, and they have been working with Pfizer specifically. The vaccine for children will be packaged entirely differently than the vaccines for adults. It'll be more stable. It won't need the ultra cold storage all the way through the process. The children's vaccine will be able to be stored in a normal refrigerator. So that really makes it a lot simpler to have clinics, at schools and elsewhere in our community. And the White House allowed pre-ordering. So we placed the order. They said that it would ship as soon as the CDC gives its approval. They expect that, they're meeting on November 2nd and the 3rd. We are planning to be ready for our first children's vaccination clinics beginning in and around November 8th, assuming that it's approved on the 2nd, 3rd, or the 4th. And we want to make it available as broadly all across the state as we can.
You mentioned schools as a possible place where those vaccination sites may be held. How do you go about managing that? Of course, there is the concern that parents would want to be there or would want to make sure and ensure that they are giving the green light for their child to do it, and it's not something that may just happen. How can you speak to that process? What does that process look like with it being distributed in schools and just having the parents' overall, support and approval for this to happen?
Yeah, certainly, Ryan. We are taking the school flu vaccination efforts that we've done in the past. No child will be vaccinated unless they get approval of their parent, and that will have to be documented before the child would be scheduled for a vaccination. So, we are prepared because we've done school vaccination efforts for flu and other things. We feel pretty confident that only those children who have their parents' approval will be vaccinated. We'll be coordinating. The way that it would work, Ryan, is if a school wants to host a clinic, they are informing the Department of Health. The department is working with healthcare providers, pharmacies, clinics, to be able to staff They all have very explicit requirements. They will verify the identity of the child. They will make sure that that approval has been documented and they've seen a copy of it before they administer the vaccine. So we're confident. We've done vaccinations at schools before. We know that we have the systems that would allow us to do it safely and effectively. And most importantly, that only children who have their parents' approval will get vaccinated.
On a personal note, on the subject of boosters, have you gotten a booster yet? And if not, when do you plan to get one?
Yanji, I haven't gotten my booster yet, and we are definitely working through that. We did have a pop-up vaccination clinic for the cabinet, so we all were vaccinated in and around the same time. So we'll probably be organizing that for cabinet members that want to do that. But as you know, anyone can go to CVS or any of the pharmacies. Most of them are providing vaccinations, and they can get their boosters there. I'll probably in the next week or so get my booster.
Another restriction that continues to remain in place are the mask mandates that you have included within the emergency proclamations. How long do you think we will continue on with the mask mandates, be it indoors or outdoors? We know that this has been going on for some time now, and it has been a level of protection, if you will, against the virus. But is this something that could be a long-term thing, or do you think that this could be something that could be lifted sooner rather than later?
You know, Ryan, I think it's two different perspectives of that. You know, I'm inspired to see so many people continuing to wear masks. You know, when I'm out for a run or out exercising outdoors, I continue to see people wearing their masks, even though it's not required at all. So we are looking at, I do believe that indoors, masks a mask requirement will remain until we can get to that point where the case counts are below the 100, as Dr. Char had talked about, or that the virus activity really stabilizes. You know, in most of the CDC literature that I've seen, and just talking with governors of other states, the big regret that I hear from a lot of governors is the fact that they dropped the indoor mask mandate too early. They saw a surge in their cases, and it became very difficult to reinstitute the mask mandate. You know, I don't think that we would have that problem here in Hawaii, but we do know and understand that masks, especially indoors, does protect the individual as well as the community should someone be infected.
So if I know it's hard to nail down a timeline, but just for our own planning, how long should we expect to wear them? I mean, is this something that obviously through the end of the year is the sense that I'm getting, at least to the end of the holidays? Do you think it'll last very long into 2022? I know you don't want to give us a specific date, but you know, I think a lot of people would like to know when they can finally stop wearing them.
You know, Yanji, I do think, and as long as we continue to see the current trend and the case counts dropping as we proceed forward, we are hopeful that a lot of the restrictions will end by the end of the year. You know, we continue to see progress. I did want to also let people know, though, that as people begin to travel again, as you know, Thanksgiving is a busy travel season. And residents travel a lot during the holidays, that anytime there is significant travel of residents, we will see an increase in the number of cases. That's just, you know, there'll be people are traveling to areas that have higher incidence of COVID. And we know that there's a pretty direct correlation between residents traveling and increases in cases. So we do anticipate a little bit of an increase due to travel of residents. And we are just asking everybody to be vigilant, right? To understand that traveling is a risky activity. if they are traveling, to make sure they wear their mask, especially on the flights, and we ask them to get tested when they get back and pay attention to any COVID symptoms that they might see and get tested right away.
I want to quickly ask about the labor workforce. We know that unemployment numbers continue to drop, which is a good sign. But overall, we continue to hear from employers who say that they are understaffed, that they are having a difficult time finding skilled workers. We're seeing it in just about every industry, and not something that's confined here to the state of Hawaii, but a problem that's nationwide. What are your thoughts about this growing concern over just the ability and the capabilities that these employers are being able to staff their jobs, their companies, and having those adequate workers in place? Is this at all a concern for you, and how do you think the state can assist with that?
Yeah, it is a concern of mine, Ryan. I know that for many businesses, they are having a difficult time attracting workers. I do think that it's one of the changes that this pandemic has brought. I mean, it's everybody began working from home, and I think both businesses as well as employees, saw the benefits of working from home. Having more flexibility, being able to stop wasting time in traffic, and I think a lot of businesses found that their employees were actually more productive, especially if they could do their jobs remotely. I think the other thing that we're seeing, Ryan, I think is everybody is realizing that they can work for virtually any company anywhere in the world, and maybe they're not satisfied going back to the work that they were doing before the pandemic, or at least exploring other options and changing careers. So I think that we are working with the chamber and other business organizations to help promote job fairs and other kinds of activities to get more employees for the businesses. I do think, though, that every business is rethinking about pay and benefits and about different things that they can do to create an attractive career and attractive opportunity to lure workers back to their companies. And I do think that everybody benefits. I mean, I think that having better wages and better benefits makes for more committed and loyal employees. And I do know that one of the things about Hawaii is our loyalty to the businesses and organizations that we work for. So I think it really will all work out for the better in the long run. But it is requiring all of us to examine what our businesses and organizations stand for, and really think about what we can do to improve the working conditions for employees and attract highly qualified and motivated individuals.
We are almost out of time, but I want to give you an opportunity to share a final message with our audience today. Of course, Halloween is coming up this weekend. Last year at this time, we were encouraging everyone to trick or treat via Zoom. What's your advice to families as we head into the holiday season? And just a final thought this morning.
Yeah, thanks, Yunji. It is safer being outdoors, and certainly our children have had to deal with different kinds of Halloweens, and this is the first Halloween in a couple of years that can get back to any semblance of normal. I know that many organizations will continue to do drive-by trick-or-treating, which I think is a good thing. I think that is a safe way for children to experience the Halloween festivities. But it's a good time if parents want to dress their children up and take a walk around the neighborhood. It's a safe opportunity to re-engage in that way. And I really do anticipate, as we look at the ending of the year, that if we remain vigilant, if for those who are not vaccinated, please get tested. For those who are eligible, please get your booster shot. It continues to keep our community healthy and safe. And I do look forward to vaccinations for children. That's the biggest group of people in our community that we all care about, that is not eligible for vaccination as we speak. And hopefully in the next week or two, vaccines will become available. And I surely encourage every parent to get their child vaccinated. It's the best thing we can do for them. It's the best thing we can do for our community. So thank you so much for this opportunity.
One final question before you go. We know that you are a big UH Athletics fan. Wahine Volleyball is welcoming fans this weekend for the first time. Might we see you at the Simplify Arena this weekend for any UH games, or any plans to go to any of the upcoming UH football games as well?
I certainly plan to attend one of these, either Wahine or football games. It's just a matter of kind of working through the schedule. It would be great, Ryan. You know what it's like being at the stadium or in the arena. It's amazing what the athletes put out and all that they go through. And this pandemic has even made it worse. And it's really inspiring to see how much they are willing to represent our community. And I think most importantly, the athletes come from all around, Ryan. Several of them are really local, but they come from all around the world. And they represent our community. They truly embrace the Aloha spirit. They understand what they mean to our community, and they definitely don't want to let their fans down. So I really do look forward to having fans at the Wahine volleyball game. And we will be relaxing restrictions as we go so we can get bigger and bigger crowds, which really the athletes deserve in a safe way.
All right. Well, maybe we'll see you soon there on the lower campus. Until then, thanks again, Governor, for joining us this morning.
Yep. Aloha.
Aloha. Thank you.
Always great to hear from the governor. And, one of the big headlines coming out of our conversation this morning was those details on the rollout of vaccines for kids. He is anticipating that there will be approval on the 2nd and 3rd of November, sometime right around there when the CDC is meeting. And following that, he said the shipments could arrive in Hawaii and start getting shots into arms as early as November 8th. Hawaii is expecting to receive 40,000 doses to start, of course, with more to come. And it does sound like, compared to the last time we talked, that the distribution plan has really evolved, and that they're not just relying on pediatricians' offices, but that the rollout will largely be at clinics and schools, of course, with a lot of documented approvals from parents along the way to make sure that the parents really do agree with getting their kids vaccinated.
That's right. We also got more information about the changes that will be happening come November 8th as well, for the return of international visitors being allowed back into the country under the new guidelines that have been set forth by the White House. The governor saying that they are making efforts to reach out to foreign countries to be able to get examples, if you will, of what vaccination cards look like in Australia, in some of the other foreign countries, in Asia as well, to allow that opportunity to provide those to businesses so they have an idea of what to look out for when those international travelers return, and with some of those restrictions that require people to show proof of vaccination upon entering their establishments. The governor saying that they are looking for ways to help to create a more seamless process, not only for the visitors, but also for these establishments. But also sounding like not a lot of changes happening for the most part with Safe Travels program, that the state will continue to march forward with what they have rolled out and find ways to implement these new international restrictions and rules.
Yeah, and he didn't want to give us a date in terms of when masks could be lifted or any of the other restrictions going away. He did say that he is confident the marathon will take place, but that it will look very different. Of course, Japanese visitors usually make up thousands of the entrants in that race, and they will not be participating at a large scale in the same way this year, but that event will go forward, but no details yet on when he wants to lift other restrictions, gathering sizes, what have you. He is taking a measured approach. He is also warning the community to expect an uptick in cases following the Thanksgiving holiday, because he does expect local residents to go to the mainland and mainland folks to come here. And with travel, of course, especially returning residents, we have seen in the past that can lead to an increase in the case counts. We are going to be shifting gears on Wednesday and traveling to Hawaii Island.
That's why we're going to be talking with Mayor Roth to talk about some of the things that are happening over there on the Big Island, how they continue to manage COVID-19. They have lifted some of the restrictions. I wanted to get an update on how that has impacted the overall health and safety of the community, as well as other issues right now that are happening there on Hawaii Island. A lot going on with the volcano, of course, drawing a lot of visitors as well to the crater there, and just trying to get an update on other things that are happening there on Hawaii Island. Again, that conversation will be on Wednesday at 10:30 right here on the platforms of the Honolulu Star-Advertiser. Until then, stay safe and have a great rest of your day. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.